So what we're going to do tonight, I would say this is the beginning of new medicine, of the new medicine video webinar series. We have a few hundred slides. Nobody worry, we're going to take them one at a time. They're going to be recorded, but we're going to go through these slides over the next several months. We're taking a few slides at a time, maybe 20 to 30 minutes at a time each week. We'll be mixing it in with the DNA, other training issues, some counseling training issues. But we're going to go through what new medicine is, how we do what we do, how we're going to help people understand that how it works, how quick and easy it is to regain health and feel better and get away from all of the medications and illnesses and symptoms we have. So this is really the beginning of NMF 101, as I like to call it, New Medicine Foundation 101. We all know we like to describe new medicine as a three-legged stool. That's detoxification, hormonal balancing, and functional nutrition. Really the primary problem is toxicity, but it's a great place to start with hormonal balance because that is one of the biggest reasons why we all feel the way we feel. We might want to, a quick note, we might want to mute. There's a way everybody can mute their phones. I hear some feedback from somebody, so I just want to, and someone just came off mute. If we can, if we all can mute again, that sounds very, very clear. I want to make sure this is nice and clear so we can invite, and I'd like to ask people to invite as many as they can to these webinars to view them, tell them to turn their brains on for 20 or 30 minutes and really understand the power of new medicine and how it does what it does. So hormones is a great place to start. Everybody gets excited these days to talk about hormones. We know that they're very powerful. We know that we know for the most part they're quite imbalanced. And again, it's not the primary problem. The primary problem is toxicity, but some of these toxins create hormonal excesses. There are hormones in our environment and our foods that are becoming much too high in our bodies, and we're becoming very hormonally deficient in other hormones, both as a result of toxins that interfere with our body's ability to create enough of these hormones, and our nutrition and our foods are depleted, our lifestyles are depleted, so we don't create enough of these hormones, and we're going to go through the first basics of them tonight. You'll see a brand on this first page here. Pure Cell is a brand that new medicine places on any hormone, nutritional product, or other recommendation that is missing in the body and needs to be replaced. There's some confusion on, well, what is Pure Cell? Pure Cell can be vitamin B, vitamin D. It can be a testosterone or progesterone prescription. It can be thyroid or other. But we don't view these as being important as to whether they're prescription or not. That's really just something that is dependent on this country and the medical rules and laws here. Over in Europe, a lot of bioidentical hormones are not prescription. So really we just view them as medically recommended nutrients that are missing from the body. And a great one to discuss is vitamin D3. It's called vitamin. It's a hormone. We're not making it because of our lack of sun exposure. So regardless of whether it's prescription or not, we really recommend that everybody that treats with us gets whatever vitamin or nutrient or hormone or prescription from New Medicine Foundation with the Pure Cell brand. They're typically, they are often much less expensive than what is available commercially, especially some of the brands that we use to prepare for us. Because we brand them and buy them in bulk, we can offer them at a discount. And if they're hormones, they come from pharmacies. We know what they're creating. We've tested it. We trust the pharmacies, and 9 times out of 10, anybody taking anything that's not New Medicine Foundation approved and not branded Pure Cell, unfortunately doesn't know what they're getting. So we're passionate about people getting the right products, and it's only going to be easier to get it straight from us, and usually at a discount as well. So to get started explaining the importance of hormones, here's a slide that a few of us may have seen. I think it's a great slide that everybody really likes. It's the New Medicine Foundation Hormone Pyramid. The title at the bottom, hip tag, is something that describes all of the various glands in the body that produce hormones and work in the hormone axis or connections in the body. Very simply, it means hypothalamus, pituitary, thyroid, adrenal, and gonads, and we'll go through these briefly tonight. There's also two subsets that we've included in there. The pancreas is often included, and we've also included skin, which is the biggest hormone in the body and extremely important as it relates to the vitamin or hormone D3 deficiencies that are probably one of the most important deficiencies out there. Now, what I often do in describing these is start at the bottom, the foundational levels of hormones, because that's where the deficiencies start. We can also look at this pyramid as, there's my cursor, this has somewhat of a physiologic or a representation of the body as well. The hypothalamus is in the very center of our brain, in our brain stem. The pituitary is just below the hypothalamus. We get into the thyroid, which was missing from this, did not get imported in. This is the thyroid here. Moving on down through the body, the adrenal glands are located right above the kidneys, and the gonads are our testes and ovaries that are the furthest gland from the brain. And what we've seen in our decade plus of testing and replacement is that up in the central nervous system, in the brain, in the hypothalamus and the pituitary, these hormones, these glands are pretty resilient. They seem to be very protected up in the good old brain, the skull that's protecting them. And they don't seem to become deficient until the very end, the very most severe times of hormone deficiency. However, down here at the gonadal level, and specifically testosterone and progesterone, these seem to be deficient in epidemic proportions and pretty much in everybody alive, even now at birth. Amazingly, babies on day one, until proven otherwise, are most likely deficient in these two crucial hormones. Granted, babies may not need a tremendous amount of them yet, but in our testing in children as young as age 3, we've found these to be deficient. And there are markers from the pituitary that confirm this, that tell us LH and FSH are often high, which tell us that the brain itself is telling the body and the gonads that even in a 3-year-old child, these hormones are deficient. These are telling the glands to make more. So that's pretty amazing, and that's really because the toxicities are so pervasive now that mothers are toxic, the birthing process is incredibly toxic. And even in newborn babies, these normal gland hormone-producing systems aren't working in children. And this is a huge part, this right here. The low testosterone and progesterone and the high estrogen we're going to talk about in a second is a huge part of why our youngest generation, our children, are not feeling well, are not physically or mentally well, and are developing the same problems that adults now are. It takes much less time to get ill. Toxicity and this secondary problem of hormonal imbalance. So the deficiencies start here. The gonads are unable to produce the hormones that they should as a primary result of toxins in our world, in our agriculture, in our household products, and most commonly now in our foods that disrupt our body's ability to make these hormones. They are called neuroendocrine disruptors. A nice example is called atrazine, A-T-R-A-Z-I-N-E. That's just one example. There's literally thousands of these hormone disruptors. Atrazine is one that's very commonly used in agriculture and very well known in animal studies, that when administered to animals turns off these hormones, collectively known as androgens, and allows the estrogen dominance that's already in our world to become much worse, and most commonly causes male rats and other tested animals to nearly turn into female rats, gain weight, swelling, and all the things that estrogen does. So this is the same thing that's happening in us. Again, atrazine is just one example, and this is the primary problem. So people who go through new medicine treatment will see that testing male or female hormones, specifically these, we also include some adrenal hormones, DHEA, and some differentiated estrogens and other hormones are included in the saliva test to document immediately in all of our patients how significant the deficiency is and whether replacement is needed. Now, replacement typically is needed. Most women benefit from and immediately feel better both mentally and physically from a blended progesterone and or DHEA replacement. Men similarly with testosterone, DHEA, and men also need progesterone as well, which we'll get into at a later time, but progesterone is very important in a man's health as well, specifically prostate health, just as it is in uterine health in women. So we start there. That is the primary hormonal deficiency. The androgens are low and the estrogens are high. We'll touch on estrogen dominance real quickly. Of the toxins in the world, the synthetic, fake, chemical estrogens are a huge problem, mainly because we use them in most of our livestock. Estrogens make all of our animal products bigger, fatter, faster. Cows, chickens, pretty much anything that is not marked organic, grass-fed, free-range, you name it, is going to have estrogen added to these animals because it makes them develop and mature twice as quickly, typically almost twice as heavily as well. So these animals are much more profitable and brought to slaughter much quicker. Estrogen is a very necessary hormone for pregnancy, and women go through very high levels of estrogen every month in order to grow their womb. But when a woman is not pregnant every month, that is no longer needed. That is what a monthly cycle is, and the estrogen comes back down to lower levels. Estrogen is also at very low levels after menopause, as should be, and menopause is not an illness of estrogen deficiency, as we've been led to believe. The problem is too much estrogen. Estrogen creates tissue and fat growth. We retain water. We have more swelling. We are actually a bit more irritable in combination with low progesterone. So estrogen does a lot of unwanted things in excess, and all of us have these estrogen excesses from our environment, as well as other chemicals that just add into the estrogen problems, as in a lot of the oil-based fertilizers or petrochemicals that act like estrogen. There are a lot of the plastics problems like BPA, bisphenol A, and phthalates from plastic water bottles and all the other plastic products we use that actually act like estrogen as well. And all of the soy-based products we use, especially the genetically modified soy, these act like estrogen as well. So we've got this triple whammy of too much estrogen out there. And it all adds up to too much weight gain, too much swelling, too much, not even to mention cancer risks. Estrogen is a huge problem. Talking briefly about how traditional medicine attacks this problem, they're going about it completely the wrong way. They're giving almost every woman out there estrogen, whether it's in birth control pills for young women or older women, estrogen for menopause, which is the wrong hormone to be given. Women need progesterone. If you know any woman that's on estrogen, she most likely does not need it, and it's making her more unhealthy. And not only that, they're using, for the most part, synthetic estrogens, estrogens from horses and labs that are even more cancer promoting. And unfortunately, even the alternative or the natural hormonal-based treatments out there are on the wrong track. They're still giving women more and more estrogen. Even though it's bioidentical, nobody needs more estrogen. Estrogen dominance is the problem. We need to detoxify that estrogen out, which is what we do with Cell Center, and the education of avoiding all the products in our foods and households that are estrogen. We need to replace the balancing hormones that are missing, which is the testosterones and progesterones. That's what the saliva testing allows us to do. Very quickly, saliva testing is more accurate because saliva is much more 97% like cell fluid. Cell fluid is where we store these hormones. Blood is where we transport them. The transport fluid, the blood can look normal until our actual storage, our cell storage, is almost at zero. I often describe it as the fuel tank and fuel lines in a car. Our fuel tank can be almost zero, but our car is still running, and not until the fuel tank is absolutely empty does the fuel line zero out and our car starts to sputter. It's the same way with our storage tanks of these fluids, although we start to feel bad before the storage tanks are empty. So this is a huge thing, and this is really where we start with the male and female hormonal tests. They're saliva-based. It's a great place to start because if you can document this, and it only costs a few $100s, and the supplements themselves are far less than $100 a month, typically around $50 a month to get a good bioidentically produced pure cell product specific for the patient. you can have tremendous effects within days of replacing these deficiencies. And so it's a good place to start for people who are a little bit hesitant or a little bit financially troubled. People don't feel well. These have a tremendous, tremendous impact on not only our physical health but our mental health. In the next couple parts of the hormone talks we'll have in the following weeks, we'll get into some of the specific things that these hormones affect, but I can tell you that they are a huge part of our health, both mentally and physically. A huge part of our anxiety, our insomnia, fatigue, depression. Really most of the psychiatric problems out there are hormonal imbalance until proven otherwise. The drugs that psychiatry is using make the problems worse, are very addictive, and really create a biochemical imbalance in the brain where there wasn't one before. Moving on up the pyramid and up the body, we get to the adrenal glands. These are a less well-known gland, but really a hugely important gland. They're very small on top of the kidneys, and they're really the quarterback of our entire body's hormone system. Very, very important. They produce not only the hormones seen here, the cortisol, DHEA, which is a very important hormone precursor, and aldosterone. They also produce adrenaline, of course, epinephrine, things that create the fight or flight response when you feel excited or scared. It's what you get, the rush of energy, and you see a lava flow coming your way, and all of a sudden people can run 30 miles an hour and escape it. That's adrenaline. These are incredibly important. There are stress gland and produce stress hormones, and in the media we're getting incredible misinformation that we're overstressed, and because of that we have too much cortisol. Cortisol is the bad guy. That's completely wrong. And it took me a few years to realize that, and a lot of testing, both on myself and patients, but some great mentors taught me how adrenal fatigue is typically past stage 1, which is where the cortisol is in excess, and where most people, by the time you feel bad and you have symptoms or illness, you're in stage 2 or 3 of adrenal deficiency, where cortisol is going to be very low. This is why we get adrenal stress testing in every patient now as well, because it's a given that everybody is in some state of adrenal fatigue, and it's very important to know how much right off the bat, because more than half of the time it's very significant, and people are going to need some focused adrenal help. The deficiency here makes the adrenal problems even worse. Adrenal glands can step down and produce these hormones that are deficient, and they do. DHEA can be converted into testosterone, progesterone, and the adrenal can step in and do this, but because this deficiency is also being asked of the adrenals, that just makes the adrenal stress worse. So this is where you start. We typically prescribe specific amounts of either of these for male or female patients. We mix in an appropriate amount of DHEA to provide some balance and support. Again, progesterone in men at specific amounts for prostate health. And that's going to help support this adrenal fatigue, and about half of the time that's enough. That's all we need, and the adrenals get better and people feel better right off the bat. Wake up feeling fresh and energized. They're, not to mention, very quickly, the cortisol controls sugar. Deficiencies here cause sugar cravings. Deficiencies here in aldosterone cause salt cravings. These typically get much better. And hormones in general come from fats, and so there's a lot of fat craving out there as well. All of these things get better, not to mention other things we're going to talk about. But oftentimes the adrenal fatigue is severe. We will actually step in and prescribe cortisol for people. It's something I use from time to time when my adrenals feel fatigued. It's something that we teach people to realize how fatigued their adrenals are. If you wake up and it takes more than 20 or 30 minutes to get going, you're reaching for that second cup of organic coffee, you just can't stay awake through the day or feel sharp, more sugar and salt cravings, more brain fog and energy issues, and even troubled sleep. The adrenals can't shut down. These are all signs of adrenal fatigue. And they all get better, starting with step 1 here, replacement of these deficiencies which are so severe. And sometimes we come in and replace cortisol as well for either a short time or in people with severe fatigue. And oftentimes there's a lot of significant physical or mental illness along with it when adrenals become severely fatigued. That's a part of why these illnesses exist. It may be something that's needed long term. But again, it's all bioidentical. It's all natural. And whether it's a vitamin we're not getting enough of or a hormone we're not making enough of, we need it. We have to replace it in appropriate amounts for our bodies to be healthy, because our bodies, typically these glands are too far gone, they're not going to catch up. And unfortunately, nutrition alone isn't going to do it. Now, before we get into thyroid and on up, these will be a little bit simpler. There's a big difference between how new medicine balances hormones and how anti-aging or some very common alternative therapy physicians do this. We believe in testing, in accurate saliva testing, and in balancing it at appropriate levels for each patient, whereas anti-aging doesn't necessarily know how to get the appropriate levels with saliva testing. A good way to know if a doctor's on the right track, or any practitioner, is if they're prescribing estrogen for women, which is 99% of the time incorrect. They also like to prescribe testosterone for women, which is usually incorrect as well. They prescribe testosterone for men alone without progesterone, which is not healthy. They do it in injectable synthetic forms, which is not healthy. So again, everything new medicine does is going to be with bioidentical, organic, natural compounds, the same things our bodies make, very easy to absorb and take, little pills that are prescribed perfectly for the patient. It's just another vitamin you take every day. It's very simple, and it's very, very important and cost-effective and easy to take. So just tremendous differences in how we do things, and tremendous in the strength of the science behind how we do it, the way we prescribe it, and the way we prepare it. And again, we want everybody just to get a good prescription, hopefully the Pure Cell brand. We like to teach people that, again, the cost is either less or similar, and it's worth the quality and the ease that it's going to be the one you want. Moving on up this pyramid, thyroid. Somehow thyroid got left out here, but the thyroid gland is also a very commonly deficient gland. Traditional medicine thinks it's either really on or it's off, but really a thyroid should be optimal, and there's some very specific levels that thyroid tests should show. We test thyroid in blood. It's more accurate in blood work, and it should be optimal. Thyroid controls metabolism, energy, hair, skin. All of these hormones really control the health of all of our bodies. Progesterone, for example, does not just affect our uterus. It affects our entire body, as all these do. So thyroid's the same. Thyroid, through detoxification and improved eating and nutrition and weight loss, can improve naturally. And we often see it improve about 50%. So sometimes, if it's not too deficient, we'll just recheck it after the detoxification and metabolic balancing and see how much it's improved. And it'll have improved quite a bit. And patients may not need any thyroid balancing. If they do need it, however, again, we're going to step in with bioidentical, Pure Cell branded thyroid. It's a blend of T3s and T4s, natural, and again, completely different from the synthetic Synthroid and other products that have been promoted so much by the pharmaceutical companies for profit. It's just natural thyroid. It's very easily absorbed by the body, very naturally balanced, and can make a huge difference in how we feel. Energy, optimal weight balance, you name it. Thyroid is deficient in about half of the people we test. It's a common glandular deficiency. It typically doesn't happen first, but will happen as we move on up this pyramid of hormones. On up into the brain stem, the pituitary and hypothalamus. This is where these two, luteinizing, follicular stimulating, these you don't need to know as much about, except that they increase as these decrease. So they confirm for us when these are low, and you'll see these on test results. Gets a little complicated there, but that's what those do. Now, growth hormone is one of the last hormones to become deficient. It's very important. It doesn't necessarily just make us grow bigger and taller, and people say, oh, if you give me growth hormone, I'm going to be 8 feet tall. That happens in very odd cases of pituitary tumors, but growth hormone can be a deficiency. It is one that is related to insulin over here. We'll jump over and talk about these last tonight. If insulin is high, which it is in most people because of the dietary problems and the diabetic tendencies of everybody these days, growth hormone can be low. So we'll see it low in about half of people on initial testing, but we'll also see insulin is very high. As we detoxify and correct all of these hormones, insulin will come down, as does diabetes and any diabetes risks, and growth hormone oftentimes comes right back up. So that's natural anti-aging I like to see, and we can see the growth hormone levels often double. And again, growth hormone is very important overall for health, vitality, well-being, energy, heart, bone, skin, brain health, you name it, very important. If growth hormone does not come back, it is a sign to any new medicine trained person, that the hormone deficiencies extend all the way up from down here at the foundational level all the way through the brainstem, and that person is pretty much just literally stressed out. It gets more severe with added years, added stress, illness. Anything that stresses the body will cause these deficiencies to get worse and go higher in the hormone pyramid. And if growth hormone does not come back, that's okay. We just have to replace it. It's a little more tedious. It's an injection. It is a pharmaceutical. There's no bioidentical source. But if you need it, it can be remarkably important. And again, about 20 to 25% of people these days need growth hormone replacement. We're getting to the point of being that ill with the ignorance of the health problems we truly have. The hypothalamus is where leptin is not produced, but it's where it acts. Leptin is for a better name, is a fat or hunger or weight hormone, and it's produced in the fat cells. And the heavier we become, the more leptin is produced. So it's also produced when we eat. And leptin works on the hypothalamus and tells us that we're full. As we become heavier and we have more leptin in our systems at all times, this hunger response mechanism stops working. So we get heavier and hungrier, and it's a downward spiral. You have to reduce the fat cells and the amount of leptin quickly. And when you do so, the leptin sensitivity in the hypothalamus will improve, and that's how people come out of the detox feeling less hungry, and we say that the hypothalamus has been reset. We can get a bit scientific here, but we have more receptors in the hypothalamus now that the leptin levels are lower, and it works better. So when we eat, we get full faster, and we can push that second piece of pizza away. It's amazing how it works, but we document this very clearly with leptin levels before and after our treatment. You can see them drop from as much as 50 or 60 or higher down to 10 or 20, or even lower where optimal levels are less than 10 or even less than 1 in someone that's very, very lean. Very quickly, the skin, vitamin D3, not actually a vitamin but a hormone, incredibly important. Everybody should be on 5,000 units of vitamin D3 a day. They should get a Pure Cell brand. It costs $5 a month, and it would reduce the cost of all cause of illness from colds to cancer by 50%. We're just beginning to realize the importance of D3. It's incredibly important. It comes from our skin, from sun exposure. We're told the sun is evil. We put on 100 sunblock every time we walk out the door, and it's not rocket science as to why we're so deficient in D3. We test for it in the blood. We teach people to get more adequate levels of sun exposure, of course not wanting to get burned, but we should all have healthy tans based on our skin tone, and that will increase our levels naturally, but we don't nearly get as much sun as we need, and so we should all take vitamin D3 a day. We replace this immediately with testing, and we test for it again in the blood, and it's very easy to show that low levels come back to normal. And the pancreas is also included in here, mainly for insulin. Not rocket science here, but too much sugary and glycemic food in our diet, kind of what the FDA told us to do for the last 20 or 30 years with 10 to 12 servings of starch a day, which isn't really the way humans are supposed to eat. So not surprisingly, we're all getting diabetes. It's not whether it's in our genetics or our families anymore. We're all at risk. 2/3 of Americans have it. Only a third know it. Everybody's at risk. We can see it coming from a mile away, and you want to reduce the levels quickly. These are the fasting levels. We, again, do this. We show it in before and after blood work. We reverse and prevent diabetes. It's really very simple. And we'll get more into sugar balance in later talks. We have a good couple slides to show how we can see diabetes coming from decades away, and you don't have to wait until your doctor tells you your sugar in your finger stick is high and that you have diabetes. You can see it coming from quite a ways away. So that's a quick run-through of the pyramid, and that's a lot of information, but with the thorough lab data we get, and why we're so passionate about getting thorough lab data, is because we can see all of this in really a glance. With a few good sheets of information combining both adrenal saliva testing, male or female hormone testing, and all of these other hormones that we get from blood testing, we see this balance very clearly. This is how we can provide care virtually. This is how we can educate our patients and know really what their health is like even without looking at them. But of course the good health history questionnaires and symptom questionnaires we get only help. make it very obvious what's going on. And we basically just bring all these hormone levels back into balance. We reduce leptin, reduce insulin, reduce estrogen levels, and we replace androgen and adrenal and thyroid and vitamin D and growth hormone levels if needed. Some may come back naturally, some may need to be replaced. It's always going to be bioidentically with natural and cost-effective and efficient replacements. And it's that simple. We do that for the entire body, but hormones are incredibly important in how we feel. Very powerful. When you do this correctly, that's why the results that we get are so quick, and within days people know something good is happening, and within weeks they're really new people, and within months we can have their entire health restored. Going to wrap it up pretty shortly here. That's a lot of fun stuff. This is a great slide to show interested people. This talk will be something great to show anybody interested in what we do. Very important to show people who are getting hormonal treatment from other sources, because unfortunately it's not being done correctly. Very important to show any doctors that we know out there that want to know what's going on with the body. Amazingly, hormone specialists, OBGYNs, endocrinologists just haven't been taught this way. They've been taught this is low, take a drug. Menopause, estrogen is low, take synthetic estrogen. You have diabetes, it is what it is, take diabetes medications, don't worry about your insulin, it's too high because it's your genetics. All of this happens for a reason, and it can be replaced. As we get into the next, I think there'll be 2 or 3 parts to this hormone talk. The next week we'll get into the specifics. This will be the first slide we look at of some of the excesses of hormones that we went over tonight in the slides, but we'll get into it in text form here and show that leptin and insulin and estrogen are the hormones that are most commonly too high, and where they come from and how they affect the body. And we'll go through and look at deficiencies. Then we'll relate all of these levels into specific conditions, specific medical specialties, and why really anybody with any kind of condition can benefit from the way new medicine balances hormones, and that very simply, with proper testing and treatment, we can start to feel better much more quickly.